Welcome to the second episode of our show, Your Comfort Place, which is a new series for exploring health matters with Dr. Patrick Wynn. I'm Bernard Gins, a communications consultant with a background in journalism. I do a lot of work in the healthcare sector, particularly in technology, research and innovation. I'm delighted to be joined again by Dr. Patrick.
Thank you.
Who is a senior GP, a hospital specialist at Jimmy's in Leeds, a clinical entrepreneur, and a provider of medical services to horse racing events. And I'm going to ask you about that at some point.
Okay.
Patrick is also Chief Medical Advisor to Caversham Health, which specialises in British designed pressure care and mobility support products for sitting, sleeping and moving. So welcome back, Patrick.
Thank you.
Today we're going to be discussing the importance of sleep. To set the scene, problems with sleep can affect how one feels physically and mentally, and how you feel physically and mentally can affect how you sleep. So it's like a bit of a circle there. One in three people apparently suffer from sleep problems, and it's particularly common in older people. So that's the big picture. To start with, Patrick, can you tell me how much sleep do we actually need as human beings?
Well, I think everybody's different, and teenagers seem to need infinite amounts of sleep. And as you get older, in fact, you need less sleep generally. Some people will never sleep well, and some people will sleep right through. So it's variable, but it gets less as you get older. I certainly, for one, can't manage with less than 6 hours sleep, but I guess that other people might need more than that.
Margaret Thatcher famously survived on 4 hours sleep a night whilst running the British economy.
Yes, amazing. Might explain a lot.
Yeah. Okay, so what's your experience as a GP seeing patients with sleep problems? What trends are you seeing?
Well, this is interesting. I think there's two sides to this. There's people that will present saying I have a sleep problem, which might be snoring and nothing else. Might of course be sleep apnea, which is where you actually stop breathing for a period of time. It will always restart. Don't worry, it will always restart. But and that used to be called Pickwickian syndrome because it was described in Pickwick's book, Mr. Pickwick. The description of it describes perfectly sleep apnea. And he was heavily overweight and his airway would close and then he'd snort and start breathing again. And that's what a lot of people think about when they talk about sleep disturbance. But interestingly, sleep might impact in other ways, and people with headache, I will ask how they sleep, and every now and again it'll lift the lid on a sleep disorder. People with high blood pressure's raised if you don't get good sleep, and even just generalised pain. And I'm going to tell you the story because it's something that I remember very, very fondly, I suppose. A lady with headaches, I think it was. In fact, I can't even remember what the initial presentation was. And I asked her how she slept. And she said, I never sleep. I've got restless leg syndrome. And so has my mother and my sister and my brother. And she just accepted that her legs dancing about in bed at night kept her awake, and she never really got quality sleep. She didn't know there was simple treatment. So I arranged simple treatment for her, gave her a prescription. And I saw her again a couple of weeks later. And bear in mind, this lady is probably 70. She came in and I said, so how's it gone? And she said, I went to the cinema. I thought, that's very strange. And she said, all my life, I've never been able to go to the cinema. I've always wanted to, but I've never been able to sit still. I've never been on a bus. I don't go in public places. And this poor lady's whole life was ruled by her restless leg syndrome that we only discovered because it was impacting on her sleep. It's a fascinating story.
What is restless leg syndrome? Is it as it sounds?
It is. If you were to film somebody in bed with restless leg syndrome, it would look like they were dancing. Literally, the legs bouncing around. Again, people will mistake it if they get a bit of achy leg or whatever. Restless leg is very profound.
And does it run in the family?
And it's very genetic, yeah. Yeah.
Mm.
But I just think that's such a lovely story that this lady's life was so disturbed. I know it's not necessarily sleep, but it was unearthed because of the importance of sleep and the reason that I would ask about sleep. Yeah, and so there will, of course, as you said in the intro, there are people that sleep is a problem that causes other problems, or there are other problems that cause sleep. And it does go hand in hand, mental health issues, and I think probably everybody at some point in life has been stressed and not slept. And we know how we feel, how bad we feel the next day if we've had a bad night's sleep. And unfortunately for some people, that's every night and every day of their lives. So I will see people with, as I say, headaches, blood pressure, pain syndromes, and a key part of it, not necessarily all of it, but a key part is quality sleep. And in many ways, if I can help improve sleep, a big percentage of all those other problems will improve.
What are the signs and symptoms of sleep problems?
Well, many people report it themselves. I'm not sleeping because, or I can't get off to sleep, or I wake in the morning, and so on. Many people's partners will report it because they sleep in the same space, and they're noted that the patients stop breathing in the night, or is tossing and turning. So those are sort of common presentations. And less common is, as I say, when you question about whatever they brought themselves in with, so their headache, to go back to that one. On questioning, you'll find that they're getting a terrible night's sleep, tossing and turning, maybe only getting a few hours, and no wonder they've got a headache and they feel awful.
Mm-hmm. What are the possible causes of sleep problems?
So obviously mental health, I mentioned, stress is very common, and we've all lost sleep at times with stress. If you're in pain, if you're uncomfortable, I'm sure we've all done an injury, maybe your shoulder or your arm or something, and you roll over in bed and that wakes you up in pain, or you cricked your neck and so on. So certainly muscular injury. And conditions, as I mentioned before, the restless leg syndrome we unearth purely.
Is that common, restless leg syndrome?
It's probably more common than we realise, but no, it's not terribly common. I couldn't put a number to it, I'm afraid.
I've heard the expression sleep hygiene more and more. What is it, and how does it help?
So I think sleep hygiene is something that you'll find plenty of information on the internet, and I think it's well worth looking up. If you can stick with NHS, anything that's an NHS website will be reliable information, and it potentially includes things that you would sort of expect. I won't drink coffee after midday. I know my metabolism doesn't burn coffee very well, and if I was to have, I see people have an espresso after a meal in a restaurant in the evening, I wouldn't get any sleep. That's an example of sleep hygiene. When you're awake, being active, so that when you're ready for bed, you're tired. Not, what's the word for it? Engaging the brain too actively before bed. So I know when I've worked shifts and I would come home in the middle of the night, I might have finished at midnight, I'd come home and my wife would say, just go to bed, it's late. And I couldn't possibly go to bed because my mind's going, I mean, there's a lot more to sleep hygiene. I'm not a sleep hygiene expert, but I, as a GP, would always direct people to an NHS, to Google an NHS sleep hygiene site.
So I find I play football on Wednesday evenings between 8 and 9. It takes me hours to go to sleep afterwards. Why is that? I thought I'd be tired out after running around.
No, I know. I see the sense in that, but you've switched everything on. You've potentially got adrenaline flowing around, your heart's racing, your mind has been active, it's still thinking, and you need that wind down period. We're all very good at doing it, well, maybe not, with our children when they're little, which is your routine of your meal, your bath, your book, and bed. And maybe we need to apply a little bit of that to ourselves.
We forget the things that work when we're young, don't we?
Yes.
So what about devices? Obviously something that's really wasn't a problem before 2007 when the iPhone launched, but what impact do you think devices are having on sleep?
Yeah, well, I think we all know, and we tell our teenagers off, don't we? You know, put it down, and it's the same thing. You're stimulating the brain, you're switching everything on. There are, interestingly, apps that will help with sleep, and you can put on music or meditation and such. So in that way, the device can be of assistance. But obviously, what do the youth of today do? Insta or whatever, all their friends all night. Snapchat, is that the one? I don't know.
TikTok.
All of those. If your mind's buzzing with a conversation, then you're not going to fall asleep.
apparently one of the reasons behind the big growth in audio and podcasts is because people use them as a sleep aid.
Yeah, well, there are sleep aids to be had, and if that
Yeah.
works, that's great. And everybody's different. Some people would like music, and some people can't tolerate any light at all, or any noise at all. So everybody's different.
Yeah, because if I wake up in the middle of the night, I like to read to go back to sleep, to tire out my mind. But my wife won't tolerate that. So.
No, reading works for me. I don't need to read for long.
Depends on the book as well, doesn't it? So, more seriously though, what are the health problems associated with poor sleep?
Absolutely all the things we've talked about, and it is a vicious circle in that mental health is heavily impacted by poor sleep. So people will be drained and tired and may simply be low in mood just because, well, in part because they're not getting sleep.
Does lack of sleep affect mood?
I think for some people it does, yeah. And you certainly won't feel good if you haven't slept. If you don't feel good, it may well reduce your exercise capacity because you're tired, and certainly your brain won't function as well. And we talk about brain fog and these things.
Yeah.
Just not being as active and as functional as you should be.
I suppose it affects the quality of your interactions as well, doesn't it? If you're tired and grumpy and perhaps a bit short with people.
I think we all know that, yeah. And it has physical health effects, direct health effects. So
there. Can you tell me about those?
Yeah, raised blood pressure, for an example. So if you're not sleeping well, your blood pressure's raised, and shift patterns do this because it's an example of disturbed sleep, effectively. So rotating shift patterns can be really hard on your body physically, and I'll see people who are suffering mentally and their blood pressure will be raised, and they change job and they get a regular job, or they have a period of time off, and all these things settle down.
Yeah.
Stress, anxiety, depression, raised blood pressure, exercise, all impacted by poor sleep.
What treatments are available to help people who are suffering from sleep problems?
Well, I think we all know sleeping pills exist.
Yeah.
And a lot of people will ask for that, and in certain circumstances that's absolutely appropriate. The difficulty is that a major part of them are sedative drugs that become addictive.
Yeah.
So if something dreadful's happened, if a relative has passed away and it's a sudden shock or whatever, that might be quite appropriate for short-term use only. Because if it becomes long-term use, it's not down to the personality, it's a chemical effect in the brain, it becomes an addictive drug. So we should be, as doctors, making sure that we don't prescribe those for long-term use. There are other things that can help with sleep, such as antihistamines, and antidepressants can be used, and those can also help with pain and obviously mood. So that might fit for somebody who's got a combination of things going on. But ideally, I'm sure we would all like to do it without resorting to medication.
Yeah.
And I think the first place we should go, the first thing we should recommend is, as you said in the intro or early on, is sleep hygiene.
Yeah.
And that's about making sure that you put things in place. Talked about putting your children to bed so that you are ready for sleep when you go to bed, and also active and awake during the day. So for some people they can have a cat nap and they're fine, but perhaps, you know, if you become so tired you sleep halfway through the afternoon, it's no wonder you don't sleep at night. And that can happen to older people who are at home with nothing to do. Will take to the sofa and have a snooze in the afternoon and then don't sleep through the night.
When sleeplessness becomes like a problem and people hyper focus on it, is that when treatments like cognitive behavioural therapy can help?
Well, I'm going to say yes, because of course it can help, and
Yeah.
in many ways cognitive behavioural therapy sounds very scientific, and it is, but actually when you think about it, it is about how you behave, and that is adapting what you do. I'm going to go back to saying sleep hygiene, and about how you think about things, and how you process things like stress. If you allow it to build and become a problem, and in the middle of the night you're thinking about it, well, if with CBT you have techniques where you think, I know this is how it is, but this is what I'm going to do about it, and you have exercises you can work through, then I'm sure by addressing that stress you could improve your sleep.
Can you recommend any good exercises? You can do in the middle of the night.
I'm
obviously not doing 20 press-ups or something.
No, well, if you think counting sheep, I'm not sure that actually works. Yeah. What I would recommend is to look up sleep hygiene online.
Yeah.
Because
with the NHS website.
With an NHS website, because it's a big subject and it's different for everybody.
Yeah.
So there's no simple count sheep and that will work. It's vastly more complex than that. And it may be a combination of all the things. It might be caffeine related, which is part of lifestyle that you can adapt. Not getting enough exercise. It's all of those things, but that's where sleep hygiene, looking up and understanding sleep hygiene comes in.
Because alcohol can affect sleep, quality of sleep as well, can't it?
Absolutely.
Which isn't so well understood, I don't think.
Absolutely, and alcohol in small doses is actually a stimulant for some people, and then obviously in higher doses is sedative. So that might, I'm sure I know people who've come to see me who are using alcohol as a sedative to go to sleep, but then when it wears off, they're waking up, and of course it's not quality sleep. And without quality sleep, you might have been in bed for a period of time, but you won't feel that you've had a good sleep.
Mm-hmm. So it's basically sort of his lifestyle. A lot of it comes down to lifestyle, with perhaps sleeping tablets as a sort of last option.
Yeah, I mean, I would recommend avoiding sleeping tablets at all and addressing the issues that are causing it. And as I said before, if there's an acute issue, a sudden death or something like that, then clearly I think we would all understand a role for sleeping tablets. Yeah. But if you have a general sleep disorder, I don't think that's really going to help because of the addiction side of it. And for some people it is addressing the obvious. It might not be obvious to them, but having 14 cups of coffee through the day is impairing your ability to sleep. Yeah. And sometimes simple things like that need to be pointed out. Shift patterns. Shift patterns are a real problem for those people who have to work variable shifts. Then they may not be somebody whose body is geared up to do that, and actually thinking about a change of job.
Yeah, that's quite extreme, isn't it? What advances are you seeing in sort of medical technology, medical products like mattresses? To what extent can they help towards sort of a good night's sleep? Absolutely,
and I mentioned before about how a pain disorder might prevent you from sleeping because of it hurting when you move. So your posture in bed is extremely important, and a poor sleeping arrangement is going to lead to disturbed sleep and pain. So controlling the environment, so noises, light, whatever's going on around. Some people like to have a little bit of noise and some people don't, so it might be earplugs for somebody, or a face mask, or it might be putting this podcast on to drive you to sleep. And we talked about meditation apps and such that can help, and of course being comfortable, and that means pillows and mattress and room temperature all being at the optimum for you. So yes, if you're trying to sleep on a lumpy old mattress and every time you roll over it spikes you in the back because the springs are sticking through, you're not going to have a good sleep compared to a nice comfortable new mattress.
You mentioned room temperature there. Is it true that it's easier to sleep if it's colder in the room?
I find it's easier to sleep when it's colder, but equally I think everybody's different. Some people don't feel comfortable. I think if you're too warm, you wake up. But if it's cold and you can wrap a nice cosy duvet around, I think that's, for me, that's quite pleasant.
A wool blanket. Okay. So what is there a sort of a main message from you regarding managing sleep? What's the sort of the takeaway for our listeners and viewers?
I think it's look up sleep hygiene and optimize all of those different parameters. So room temperatures we just talked about, noise and light, a comfortable mattress, a suitable thickness duvet or blankets, whatever you use. And then looking at the lifestyle that, are you drinking 14 cups of coffee a day and wondering why you don't sleep? And are you getting enough exercise, and are you active, and is your brain active when you're awake, or are you actually just dozing through the day? And it's surprising how something that seems as obvious as that, in real life, people are coming into me and they're talking about not being able to sleep, and when we explore it, so many of those elements are in place, and they've just not realised because they've not reflected and looked at that.
Yes, there's a lot we can do as individuals to improve our chances of a good night's sleep. I mean, I think last year I stopped taking my iPhone into the bedroom when I went to sleep and left it in a drawer downstairs, and lo and behold, my sleeping improved.
I used to do absolutely the same, but unfortunately my children would come in late and unplug it to plug theirs in and then not plug it back in, and I'd wake up in the morning with a flat.
Okay, well, thank you very much. You can stay in touch with Your Comfort Place with Dr. Patrick by connecting with Caversham Health at our social media channels and subscribing to our show in your podcast or video platform of choice. We'll catch up again in future episodes. So thank you.